Hello, anybody hear me? Um, you come on the chat. My name is Noah. I've been working as a respiratory therapist last week for more than um, more than 15 years. Um, and I have observed a lot of patients who have breathing problems. Um, And then there's some issues that I observe. I know that when these patients, when they question the issues, sometimes the doctor doesn't have time to answer their question. So since I've been working for a while, so I'm here to address any question that any the people in the community, anybody would have regarding breathing while they are asleep, um, snoring, regarding short of breath, regarding the process, testing process. Um, if you are able to hear me, leave a comment. If you not hear me clearly, also leave a comment. Anybody could come in and leave a comment or note. Okay. As I say, I'm a respiratory therapist, so I I work in various sleep centers and with doctors that are observing patients while they are asleep. The observation the doctor does is to see what is the length of their um, sleeping problem. So the test could either be conducted at the lab or it could either be conducted at the patient house. So me as a respiratory therapist, what I do, I observe, monitor patient, and also monitor techs that apply the sensors on the patient from head to toe, and I monitor the patient via monitor while they are asleep. So as the test being conducted, and if there's any issues, also we put comment on the length of the issues that we observe as a respiratory slash sleep technician. So we put comment for the doctors to observe if we see certain issues that is interrupting the patient breathing. The issues might go from heart condition because with the electrodes that is applied, the sensors in the head that is monitor the brainwave while the patient sleep. So there is pulse ox that monitor the patient oxygen, and there's a belt that two belt that is around the patient from chest to the stomach that monitor the chest movement while they are breathing, sleeping, and also there's sensors in the legs if there's constant movement in the leg um, while they are sleeping. So from that, what we do, as we observe the patient, we will put comment anything regarding, as I say, um, abnormal heart condition, breathing problem, um, snoring, leg movement, and also regarding brain waves because some patient might experience seizures while they are asleep. So the EKGs might be different. So we observe that also. Um, and and that's what we do. And as I say, there's we I observe many patients that have sleeping problem, breathing problem. The patient could be having breathing problem that is lead to because of their weight, of their smoking, or their child. Because if the patient is working as a construction worker, or the patient is working in a laundromat and he's not wearing masks to protect the lungs, so he tend to inhale the air, the dusty air. So the dusty air might affect the patient breathing, and then that could lead to breathing problem and sleep condition. Um, Also, that lung condition could be to abnormal lung condition could lead to if the patient was born premature and the lung was premature. Um, and also, if the patient is a smoker, the patient tend to will have some kind of breathing condition and sleep problem because when they smoke, what happens is this when you smoke, it's like you breathing in um, chemical air, um, and it's warm also. So therefore, that because the example I could put to give you is like having your lungs like elasticity. The example I could present to you is like it's like putting a steamer, a pot, a bowl of water boiling and then you take a elasticity and you put it over the pot, and the steam that coming out of the boiling water is going in, it's going around the elasticity and then warming it out. So that's what happens when you smoke it. It's like when you breathe in the warm chemical substance in your lung. Since your lung is at elasticity, it will that warm air when you're smoking is where it was wearing out the air and the your lung that is elasticity, and it will cause it to wear out, and it will not go back. And that condition will last until you depart from this world. So, so this is one thing I usually emphasize to people, to my patient, or working in a, if I'm working in an area and people smoking, or if I'm walking and I see how people smoking and they blowing down their smoke around me, and I will let them know that guess what, breathing is not good for you, and it will lead a long-term problem, and it will not resolve by that long-term problem. So so therefore that I will mention that to that person, but um, I kind of digress from my explanation. But what that's what happened when you smoke. So when the lungs wear out, it will not bounce back. So it will lead to heart condition. It will lead to breathing a decrease of oxygen. It will lead to not also and also it destroy the cilia that move the mucus when you have to cough out mucus. It will destroy the cilia. It will cause the increased amount of mucus production when you smoke. So that's why it's more common and it would lead to breathing problem. So patients that experience this condition and their lungs wear out, they will end up in oxygen throughout their life until they depart it, or they will have to use a CPAP machine. A CPAP machine, what it does is help it is to kind of um, remove them from the oxygen. It would be if like regular oxygen we breathe in instead of 100% oxygen, because 100% oxygen um, could affect your blood cell. So therefore, CPAP it's oxygen mixing with other air and nitrous oxide and other. So it's not 100, but it keeps the airway open. It keeps your oxygen, your blood fully oxygenated, and also it keeps the airway open. So that's what the CPAP does. When you go to, if you experience any snoring, shock, breathing problem, short of breath, headache, constantly going to the bathroom for to urinate, that could be a sign that you're having sleep apnea. Um, Also, another effect that will cause to sleep condition. We are built the way we are created. If you are a certain height, based according to American standard, you're supposed to be a certain weight. When you go above that weight based on height, it will affect your breathing. It will affect your oxygen. It will affect your sleep, because when you are asleep, it's only two things that is in control. You're not in control. When you're awake, you have in control of your breathing. So therefore, that if you go to the doctor, you will tell the doctor, well, doctor, I'm experienced. Um, I'm not having difficulty sleeping, and this is what I'm experiencing. And then he will have the regular physical test done. When he does that regular physical test done, regarding take your oxygen, all the things, we put a pulse ox in. It will get a record that your pulse ox is 98, your oxygen is 98, so there's no problem with you. So the doctor will might kind of overlook your situation. But the only the regular physician doctors, but the doctors that might pay attention more to your condition is lung doctors, um, that that deal with um, that know about the condition based on your breathing. Your pulmonary doctor will know about that. So your heart doctor, mm, the only way he might suspect is you have a sleep problem if your heart doctor have a heart test done and it shows that there is a abnormality in your heart, on your EKG, then he might suspect, okay, there's something going on here that causing the heart abnormality. So then he might refer it to a sleep doctor. Um, so if you experience this symptom, this is the sign. This is the sign that okay, you might need there might be some kind of sleep apnea. If you're snoring loud, if you based on your height, you over the weight based on your height. For example, I am 5'7". According to American standard, I suppose to based on my height, my weight is supposed to be from um 140 to 160. So if I go above that, if I'm 200, so therefore that I will experience some breathing problem or snoring, Um, but it will be mild because there's mild, moderate, and severe. So my condition might be mild, but other people that is like 300 pounds based on their height and weight, um, it might be moderate to severe. So if that issue does not fix at a certain time, it could lead to death because there's people that die because of their sleep condition that was not resolved earlier. Because if you're having breathing problem for a long time, it will affect the heart. Because what is uncontrolled when you're asleep is the heart and the lung, the heart, the lungs, and the brain. So therefore, when you're asleep, if the heart, if the brain is not getting enough oxygen, it will send a signal to the heart and say, pump more, pump faster. So your heart muscle will be pumping faster in order to provide the amount of oxygen throughout the body. And there's one thing I have to address also. Just because you are muscle and all built, that doesn't mean you are healthy. Because I have monitored patients that are look fit, and then they look fit. I mean, they don't smoke, they don't drink, but guess what? The minute they fall asleep, they are experiencing apnea after apnea. Because what happened is the muscle need oxygen also. So if you turn the fat into muscle, then the heart has to supply oxygen through throughout the muscle. So therefore, that if the heart is not, if the brain is not getting oxygen, the brain does not see there's enough oxygen going through the heart, going through the body. It will tell the heart to pump faster. So as the heart is pumping faster to provide enough oxygen throughout your body, after a while, like 10 to 5 to 10 years, you will experience heart condition. Once you experience heart condition, if you don't fix it, then the inline of the heart because stiff. So it will now once it's become it's like a bodybuilder, a man that chooses to build his muscle, and after a while all his body is built with muscle. There's certain things he cannot do. He cannot run fast because of all the muscles that is around. He cannot. He's somehow restricted doing certain things. So therefore, that is the same thing as the heart when pumping. It's pumping um, blood throughout the body and oxygen. After a while, the heart starts giving up because it builds muscle around it. There's muscle that built around the muscle. It becomes stiff. So therefore, that it start warning. It's not pumping as it used to. That's what lead to heart problem, heart condition, hypertrophy. That means the heart muscle around the muscle build up, so it stop. It cannot build as it need. It cannot pump as it need to pump. So in this condition, the patient will have to have a pacemaker done, put in, or have a heart valve. If the valve become wear out, have it fixed or replaced, and the patient will have to lose weight also. The patient will have to lose weight um, in order to, based on height, height based on height, he has to lose weight, and for him to at least to maintain a normal life. But let's say you want, if a patient come in, experience this condition, and the doctor will request a test being done. The test that is being done, the doctor will monitor the test. Once the doctor monitors the test and he observes that there is some kind of problem there, he will request the patient to come back to have a treatment done. The treatment for sleep apnea, whether the patient is overweight, smoking, a smoker, um, or snoring. There's different. There's the the less invasive treatment, but there's patient that will the doctor can recommend to have a stomach with a reduced weight, which is a geriatric operation to help them lose the weight, so they can maintain a normal life. There's patient if they have snoring, what happens is the doctor could monitor the tonsil to find out if it's affected the uvula. So to see if it's kind of too long, because sometimes there's people that have longer uvula than other people. So the uvula will be examined, and then the doctor could have it removed, the uvula and the tonsil, that to fix the snoring problem. But usually it doesn't. The it might fix it a little bit, but if you're still overweight, you would have to still lose weight based on that. So there's a lot of people that is avoiding of they are avoiding of using the machine, and by doing that, they will go through the surgery, and then still mentally they will still be affected because they take the shortcut all way out, and sometimes the surgery does more damage than fix the problem. So short path is not always the right path. So the best thing I usually let the patient know, okay, I could give them a short advice. I say, okay, there's option that you could do, but it's up to you to take those options into mind. But the best thing is using the machine. It's not easy because I did have a few tests done on myself, sleep study tests, and I did use the machine. Using the machine, trying to sleep with a sleep machine is not easy. But guess what? I wake up more alert because it take me 30 to 45 minutes to get used to it. When I did have the test done, there's people that or other patients that I observed take them 45 to 1 hour to get used to it. But we started with our low pressure. But guess what? You were more alert. You're more energized, and then that will help you to go far as to lose weight. Because once you become more alert and more energized, you tend to want to go out and exercise. You and you eat less also, because that's why while you're asleep, your oxygen is your body is fully oxygenated. So therefore, that your heart is not overworked. You sleep more soundly. So very helpful with the machine. Now, so I usually tell what I tell the patient when they come in. Okay, there's option, but guess what? You have to do research based on if you're going for the surgery route. But because not everything that come out successful. Um, so the surgery is, I wouldn't say it's good, but guess what? There is there's people that tend to have complications. Um, uh, so while the patient is kind of trying to decide what is the various option to take, because if the insurance also, most of the doctors does not refer patient to the sleep centers because the insurance are not willing to pay for it, because one test could cost close to $3,000 out of pocket. So if you don't have a insurance that's gonna cover it for it, so the doctors are not gonna let you know that you have a condition, a situation that might lead to a further problem. So therefore that's why it's like a lot of patients will experience this problem, but they will not know about it until their condition gets worse. So when this happens, this is the point where it's like, okay, to the point that where the patient's life is really in danger, where the result might be, I mean, there's where the result might end up them being going to a hospital, and the doctor will let them know, okay, this is the situation here. You have a heart condition, and the heart condition could have been fixed a long time ago. But because they don't have a good insurance, and so if the option for them, they didn't give them an option to go there and have the test done. So it's very important if people want to pay attention to your health. If you know your body better, more than the doctor, you know yourself more than the doctor. If you experience a situation, you go to a regular physician and is not referred to anybody. You you go to a heart doctor, is not referred to anybody regarding your sick condition, your snoring, regarding your health. Probably that's a sign that your insurance, whatever the test you need, your insurance is not willing to pay for it. So therefore that whatever it is, it's gonna come out of your pocket. And there is a lot of centers, sleep centers out there that if will allow a patient, let's say the patient, the insurance is not covered or the insurance is paying half of it, the other half they're gonna have to pay for it. Then there's sleep centers that will allow the patient to come in and have the test done. But they will let them know that guess what, the insurance does not pay for it, but the other half you would have to come, it's coming out of your pocket. But guess what? It's good option. Then you know that the test you did, you get it, and to avoid any further problems in the future. Um, so that's why if if anyone who's out there that experience a situation regarding sleep, leave me a comment. I will insert any comment, and if I could help, I will help you. Um, direct you to sleep centers or direct you to something that could help you. regarding um, your sleep condition, your breathing problem, and um, also don't forget to subscribe because when you ring the bell, so therefore that leave me a comment so I could face it, get in contact with you so I could help you because I'm here to help. Because I see, as I say, I monitor a lot of patients. There's patients, they come for the first test, but then they didn't out of pocket, but get, they couldn't get the treatment that they needed because the insurance is not paid for it. So therefore that what I able to tell them, able to guide them to a way they could that would help them have a good life, mental life, a long life that will solve the situation. Um, with even though they don't have the income to get the treatment, I could direct them to another path that will help them uh, help them their health, their weight, and then to maintain a better life. It could be done without the treatment. It's all had to do with, okay, what are you doing? How are you taking care of your life, yourself? What are you eating? What are you putting in the body? Are you in an environment that is affecting your health? So just leave me a comment, subscribe, and I will if it's I will if you need my email or I will on the next um, post I will and also let me know um, what you want to know if you need what information you need to know regarding if you have a condition. Let me know about the condition, sleeping condition, what you experience, and let me know your situation. I'm here to help. I'm a respiratory therapist, and my job when I went in that field, my job is, as I say, God, my job is to help people. I didn't go to that field because of how much I was gonna make a year. Because when I went to that field, there were other people, counselors who direct me toward other fields that pay more. Me, I wasn't thinking about the money. I was thinking about this one. I'm taking a step toward this without that is to help people, not for money. So if it was for money, I would have gone toward the path of nursing because nursing get paid more than respiratory therapist, or physician assistant. That's another field that I wanted to go to. But because I know that the importance of breathing, um, the importance of a good resting sleep, the importance of breathing good environment. So that's why I went to respiratory therapy and I didn't regret it, not one bit. So leave me a comment, subscribe, and put in the comment what you want to hear, or if you have a situation, let me know, and to see how I could help you. Um, and also let me know what you want me to talk about because, as I say, I have experience in respiratory therapist, breathing, that have to do with lungs, and also sleep apnea, sleep condition. So like and subscribe and leave a comment. And I will see you for the next live chat. Hope to see you. And we could go to that path together. Um, in a better life. So I'll see you in the next stream.